Hi, everybody. Welcome back to the WHN broadcast. We're here with another news update. My name is Ben Calderwood, and once again, we're speaking with Dr. Eric Feigl-Ding. Eric, we wanted to ask you today where we're at in terms of reporting requirements. Specifically, that is the recent change to CDC recommendations. They were going to now sunset the hospital COVID reporting requirement. Where does that put us in terms of tracking cases?
Yeah, this is very upsetting. After all these years, now they're going to stop systematic reporting requirements for hospitals. And by the way, it's already been set, so it's not a sunsetting. It's already post sunset and nighttime on this. We This data was really critical because remember our previously our community levels, which the CDC we were already criticized for using community levels because we rely on hospital data alone, for the most part, was based on these kind of transmission data and how much hospitalization there is. Now we don't even have that data. So even by dismantling this reporting, we also dismantle the early warning system that CDC used to tout. Oh, just trust the community levels. Now, April and May has always traditionally been low season. So they probably timed it, oh, cases will be low around April and May. But invariably, for the last 4 years, it would always seem to surge later in the year again. So I think it was premature. Right now, of course, we have wastewater testing, the NWSS National Wastewater Surveillance System website. That's still there, but wastewater is it's indicative in certain ways of rising cases, but we don't actually know, how it translates into hospitals, especially now in the era of vaccines, where we could have a lot of transmission of cases, but is that leading to hospitalization surges? That's actually very interesting and important. Both signals matter, not just wastewater incidence of cases, but also of hospital burden. And also, I want to remind you, the wastewater in itself, although it indicates more virus floating around, it not always is. It's not always, human wastewater. So you could get mixed signals from agriculture as well that we don't know. And similarly, we see this also in bird flu, that some places in the U.S. are increasing influenza A levels, but we don't always know if that's human or if it's agriculture runoff. So we need hospital data and hospital ER emissions data, and unfortunately, we don't have that. So in many ways, we're flying in the dark again. And testing, some states still have reporting, but it's not systematic. So because it's not systematic, I can't guarantee that the reporting standards will be apples to apples across different states. And I think that's where, again, if the data is noisy like that, and it's apples to oranges, they have different reporting rules. Some states might report admissions, some might report hospital beds occupied. Some might do ER reporting, but not hospitals. Some might do ICU only, but not hospitals. All these things just makes it so much more difficult. And I think, COVID levels may be low now, but invariably it has increased again. And we haven't eliminated COVID in any way, sense, form. And we know that long COVID is still here, and multiple infections will lead to greater long COVID levels. So we definitely should need to be vigilant. And I think this is very irresponsible for the CDC right now. But oftentimes, the arc of the moral universe is long, but it will bend. And hopefully, the CDC will wake up again once shit hits the fan, I guess. But that's always too little, too late, unfortunately.
You talked about the fact that no federal level requirement means states would be reporting in patchwork fashion. You talked to some extent about, the unreliability of wastewater data, I guess, relative to human cases. Going forward, how should people be tracking COVID? What options do we have in terms of data?
Well, wastewater is still the best for tracking incidents, probably, like how much virus is spreading around you. Um, especially for COVID, that's still better compared to, it's an influenza A where you could get it from, there's a large outbreak among dairy cows, right, and other birds. But I think wastewater right now is it. You can, of course, self-test, but we don't have free testing kits mailed out anymore. Rapid tests are, you have to buy them yourselves. And whenever that happens, like these signals become very subjective. It's anything based on self-report is not very reliable. You can't compare them. You can't use it to calculate incidents reliably. So wastewater is basically all we have. And if you have these symptoms, especially once the wastewater starts rising again, you should really definitely start testing yourself again if you have COVID symptoms, because COVID is not over, and the data shows, and government reports have says, long COVID disability is one of the largest causes of disability in the U.S. and in Europe in terms of hurting the labor market. So it's not just the health and the economy. So I beseech people to still be vigilant. Right now, it's low. You can relax a little bit, but whenever the fall and winter comes again, please be mindful again, because invariably during flu season, COVID has always come back for the last few years.
That is absolutely true. As we sit here in year 4, year 5 of the pandemic, thanks again, Dr. Eric Feigl-Ding, for your time and your attention. If you would like to learn more about what we do at the World Health Network, you can find us at whn.global. We hope you'll visit the website and consider joining. Thanks again, everybody. We'll see you in another news update. Bye-bye.